Good day guys, you're welcome back to the second part of this video. In this part we'll be talking about the symptoms, the mode of transmission and how you can prevent the monkeypox. The first part was on introduction, etiology and a brief history of monkeypox, so you can go and have a look at it. I also include the link on this video. So let's start with the symptoms. The symptoms of monkeypox, I will divide them into two phases for the sake of clarity. The first phase is the prodromal phase, while the second phase is the eruptive phase. Under the prodromal phase, the first symptom is fever. This fever will be followed later on by headache, chills, muscle pains, back pains, exhaustion, then swollen lymph nodes. For the respiratory symptoms, it could be sore throat, nasal congestion, or cough. The eruptive phase will include the rashes. These rashes start from the face in most cases, then it will involve the palms, the soles, the eyes, the mouth, the throat, the groin, the genital and the anal region. When these rashes start is between 1 to 10 days after the onset of the prodromal symptoms. Some asymptomatic cases have been reported where somebody will have this disease but does not come down with the manifestations. Again, the rashes can range from 1 to several thousand, which means that all these places that we've listed might not have the rashes at the time they are manifesting. So the person can have just a rash or more than or in thousands, but it must not include all the places that have been listed. So when would somebody come down with these manifestations after contracting the virus? The incubation period for this disease is 3 weeks. So within 21 days after contracting the virus, the person can come down with these symptoms. So how does this lesion manifest? It first starts as a flat lesion, then it will be filled with liquid. Then after, it will cross over and dry up and fall off. After this, a fresh layer of skin will form. People with these rashes can infect someone as long as the rash is still there, until the rash all crossed over, dry up and a fresh skin forms underneath. The patient continues to be infectious to other people. Now let's talk about how this infection is transmitted. So the modes of transmission, basically there are two: from animal to human and then from person to person. Okay, for animal to human transmission, one of the ways is by having a physical contact with the animal, especially those that are sick or the ones that are dead, or by preparing the animal for food, or by ingesting a poorly cooked or raw meat. So for the human to human transmission, breathing in skin flakes or viruses is one of them. Then skin to skin contact with an infected person, any close prolonged face close contact is a high risk factor without face mask. Sexual intercourse including oral, anal or vaginal sex and touching of the genitalia. Then hugging, massaging and kissing. Then pregnant women can spread the virus to the fetus through the placenta. Touching objects like fabrics and surfaces that have been used by someone with the monkeypox is another means of transmission, that is fomite transmission. So for the ways of prevention, how can you prevent this monkeypox? First thing is to avoid unprotected contact with animals. Then you also have to cook all meats very well before eating. Cook them properly and thoroughly. Then you limit your contact with people that are suspected or confirmed to have monkeypox disease. Because of the fomite transmission, you have to clean your environment and disinfect all the surfaces, especially when you live with somebody that has the virus, you are taking care of someone. If you are a health worker, you should also follow the infection prevention and control measures. Reduction in the number of sexual partners is being recommended, and then wear face mask and cover your skin if you already have the symptoms and you are seeking medical attention. Remember not to donate blood if you are feeling unwell. It is recommended for those who recover from the disease to use condom whenever they are having sexual intercourse during the first 12 weeks after the recovery. Some vaccines have been produced for monkeypox, but these vaccines are not for mass vaccination. They are meant for those that are high risk, the high risk individuals. Those that were vaccinated against smallpox also had some degree of protection for monkeypox, but the smallpox was eradicated in 1980. Thank you for watching this video. Please subscribe to my channel and share this video to let people know how to prevent monkeypox. Have a nice day.